Good evening, everyone, and welcome to Sacramento County's Public Budget Workshop. Thank you all for joining us this evening to learn more about the county's budget. I'm Amanda Thomas, the county's Chief Fiscal Officer, and I'll be providing an overview of the county's budget before we provide more information on 3 county departments that we're highlighting in today's workshop. Before that, though, I'd like to introduce County Executive Ann Edwards. Ann?
Thank you, Amanda, and welcome, everyone. It is my pleasure to be here this evening to introduce Sacramento County's Budget Workshop. We're conducting this workshop as part of the county's plan to continue to enhance public understanding of and engagement in the county's budget, which we initiated with last year's budget process and plan to continue building on in the years to come. This year, we're excited to be including presentations from the directors of 3 county departments to highlight the diversity of operations and funding sources across the county. As you will see from the presentation, the county's budget is very complex, and we hope this workshop helps provide you with information about our budget and budget process that is clear and transparent. We also want to hear from you, and there will be an opportunity for you to ask questions and provide input during the presentation. I will now turn it back over to Amanda, who will provide additional details about today's workshop and then begin with an overview of the county budget. Thank you again for joining us.
Thank you, Ann. And I'm also very happy to be joined today by 3 department heads here at the county: Michelle Callejas, the Director of Child, Family, and Adult Services, Timothy Lutz, the Director of Health Services, and Ron Vicari, Director of Transportation. Before we jump into the presentation, I did want to go over a few details for today's workshop. I wanted to let everyone know that the webinar is being recorded and live streamed. For those attending live via Zoom, questions and comments can be submitted through the Zoom Q&A, and we plan to pause at the end of each presentation for questions. Kim Nava, the county's Public Information Director, is helping us manage the Q&A today, so thank you, Kim. Today's workshop is scheduled for 90 minutes, so we may not be able to get to every question, and we will follow up as necessary for any questions not addressed live. If you have more detailed questions or comments, we invite you to email budget@saccounty.gov. I will also be sharing that email address again later in the presentation, as well as other ways to get information on or participate in the budget process. And then finally, for those joining via Zoom, we also will be conducting some polls and really do encourage you to participate in those polls. So in terms of the workshop overview today, I will be briefly going over some budget basics just to help provide foundation of some basic budget ideas and concepts, and then moving into a discussion of the county's budget overall and providing a high-level overview to help you understand the county's budget. And then I'm going to hand it off to Michelle and Tim and Ron to go over some county department budget highlights for the departments of Child, Family, and Adult Services, Health Services, and Transportation. So let's actually start off with one of those poll questions just to get a sense for why you chose to participate today and what interests you about the county budget. So for this poll, you should be able to select more than one answer, and please choose all that apply. So the question is, why are you interested in the county budget? And some of the options are just curious, want to learn more, professional or community interest, interested in a specific issue or program, or other, in case we didn't happen to capture the reason that you're here today. So looks like folks are responding to the poll. Maybe give a few more seconds. We'll go ahead and end the poll and show the results. So it looks like everybody here has professional or community interest in the county's budget. And then some of you are also here for some other reasons. So thank you very much. I hope no matter the reason, I hope you find this workshop informative. Okay, so we'll go ahead and stop sharing the poll and move on, as I mentioned, to talk a little bit about budget basics. So in the next few slides, I'm really just briefly going to go over some basic budget information that I think will help build a foundation for some of the information we'll be sharing on the county's budget. So first we'll cover what is a budget. And really, sort of at its most basic level, a budget is forward looking. It is an annual spending plan that reflects all of the funding that will be available during the year and plans how that funding will be spent. For the county and other governments, the budget also provides the legal authority to actually spend money and limits the amount that can be spent for specific purposes. And finally, a budget can be used as a way to set policy direction, but it probably is more useful to think of it as a policy implementation tool, where it is used to implement policy decisions that have already been made. For example, I'll be talking a little bit later about the process for developing budget priorities, which are adopted by the County Board of Supervisors based on input from county residents and are then implemented in the budget recommended to and approved by the board. Okay, now let's turn to look a little at the legal and policy framework for the county's budget, which basically means the rules that we have to follow in preparing and administering the budget. So the first important set of rules is the County Budget Act, which is a state law that defines how all county budgets are supposed to be structured and approved. When I said earlier that the budget provides the legal authority to spend money and limits how much can be spent, this law is where that comes from. And then the rules and requirements for this are included in the state controller's budget guide. In addition to the County Budget Act, there are many other state and federal laws, rules, and contract provisions that impact the county's budget, including rules for how funding must be spent and whether we need to provide a certain amount of local funding. These laws and rules are why we really only have discretion in spending a relatively small amount of local resources, which I'll talk more about later. In addition to state and federal rules, the county has its own rules spelled out in the county charter and county code, including describing the responsibilities of county officials in the budget process. Finally, in addition to legal requirements, any board policy is reflected in the budget, including the board's budget priorities. So this slide lists a lot of somewhat technical budget terms, and I don't want to bore you too much, but I think it is important to have a basic understanding of some of these terms in order to understand the budget. So first, appropriations really means budgeted spending. So that's both money paid for services, supplies, and county employee wages and benefits, as well as money that gets transferred to other parts of the county. Reimbursements are money that's coming in from other units of the county. And then the appropriations minus the reimbursements are what we call net financing uses, or the net amount of spending in the budget. Revenue is the money that comes into the county to pay for that net spending. And revenue falls into three broad categories according to what it can be used to pay for. Discretionary revenue is money that the county can use for any public purpose, and it primarily includes property tax and sales tax revenue. However, because of some of those rules and required spending and mandated service levels that I referenced earlier in the legal and policy framework, we really are limited in terms of how much of this can be spent for any purpose, because some of it does need to be spent for specific purposes. Semi-discretionary revenue is money the county receives from the state in the form of realignment and public safety sales tax. This revenue is restricted to certain broad categories, but the county does have some discretion as to how to spend this money in those categories. And then finally, departmental revenue is revenue that's use is restricted to the programs within each department of the county. So this includes funding from the state and federal government for specific programs, as well as fees collected by departments for specific services provided. Looking over to the right-hand side of this slide, net county cost is the term we use in the budget to describe the appropriations that are funded with discretionary resources. And you'll sometimes hear this referred to as general fund. In addition to revenue, appropriations can also be funded with fund balance, which is basically like the balance in the county's bank account. So once that money is spent, it isn't available to fund future year spending. And instead of spending the fund balance, that money can be set aside in reserves, sort of like a savings account to be available when needed in future years. Okay, so now that we've gone over some basics, we're going to dig in a little bit into the county's budget. But first, I wanted you to know that you can go to the Office of Budget and Debt Management webpage, bdm.saccounty.gov, to access all the resources that I will use. So the county budget document itself is by far the most comprehensive resource or source of information on the county's budget. And it includes all the elements listed here on this slide, with 3 budget documents published per year. But at over 1,000 pages, it may be more information than what you might be looking for if you would just like a higher level understanding of the budget. For that, I would recommend the Budget in Brief, which is also available on our website. Includes a lot of information that I'll be going over in this presentation, and at just 7 pages is a much easier read. And then for anyone who would like a more interactive way to understand the county's budget, we also have a Budget Explorer tool available on the website, and that allows you to drill into the budget to see department and expenditure detail in a graphical format. Okay, so that brings us to our next poll question. And the rest of these polls are really kind of meant to test your knowledge a little bit. But if you don't know the answer, please just give it your best guess. So we'll go ahead and get this poll launched. And the question is, which revenue category represents the largest source of funding in the county budget? So that discretionary category that I talked about, semi-discretionary, or departmental. Few more seconds for folks to finish responding. Okay, let's go ahead and close the poll and share the results. So we actually have a 50-50 split here. And those of you who selected departmental were right. So departmental is the largest source out of those 3 categories of revenue. Let's go ahead and stop sharing that. And I will actually show you what that looks like here on the next slide. So this chart is showing the county's total overall appropriations for the current fiscal year, 22-23, of $7.9 billion, and how those appropriations are funded. So you can see that the largest category is indeed departmental revenue at about $4 billion. Another really big slice of this pie is transfers within the county, or those reimbursements that I talked about earlier, which is really just money moving around between and within different units of the county. So this accounts for about $2 billion of total appropriations. And then semi-discretionary revenue is about $1 billion. And finally, that discretionary funding is actually the smallest category at $888 million. And within that, property taxes represent by far the largest source at about $565 million. So this chart is showing us that same $7.9 billion in total appropriations, except this chart is showing how the money is being spent. And you can see that about $1.9 billion is in non-operating and other budgets, and that roughly lines up with those transfers that we saw on the previous chart. So of the $5.7 billion that's actually in our operating budgets, you can see off to the right-hand side how that is distributed among the different functional areas of the county. So social services represents the largest share at about $2.2 billion. This includes 2 of the departments featured today, Child, Family, and Adult Services and Health Services, as well as other departments such as the Department of Human Assistance. Community services represents the next largest share at $1.7 billion. And this includes the 3rd department that we'll be hearing from, transportation, as well as other departments such as regional parks, airports, and waste management and recycling. Public safety and justice represents about $1.1 billion, including departments such as sheriff, district attorney, public defender, and probation. And support services, including internal services like technology, finance, and personnel. And then general government represents smaller shares of total spending. These charts show how those same total overall totals by functional area, with the size of each of the donuts here reflecting the relative size of the budget for each functional area. And then it shows how the funding for each of them is broken out in terms of the three categories that we've been talking about. You can see that that green departmental category is the largest category for every area except for public safety and justice. And in the social services, this is largely state and federal funding, whereas in community services, this is also fees and other revenues for many of the services provided by the county. I want to talk briefly about some of the key factors impacting the county's budget this year and as we look forward to next year. You may have heard about the American Rescue Plan Act, or ARPA funding, that the county and other state and local governments have received from the federal government for COVID recovery spending. For Sacramento County, this is about $300 million that can be spent between now and the end of 2026. And one of the things that we have to consider with ARPA and other one-time funding sources, including fund balance, is how to sustain the programs that are funded with these sources, which really requires additional sources of funding to be identified. In looking at the budget, the county also has to consider legal obligations, which must be funded. One example that you may be aware of is the May's consent decree regarding conditions in the county's jails, which has required substantial additional investments in staffing in recent years and will require even more in the years to come as the county addresses needed facility improvements. The county also has other capital and maintenance needs, and Ron will speak to that specifically when it comes to the needs for county road maintenance. And then we are also, of course, impacted by what's going on in the economy generally, with inflation resulting in increased costs, as well as economic uncertainty and a potential recession, which would negatively impact the county's revenues. And because many of those who rely on social services and other services provided by the county need these services the most during economic downturns, it's really important for the county to try to maintain services to the maximum extent possible. And one of the ways that we can do that is by trying to build our reserves to a level where we are able to weather an economic storm. And this chart here is really showing what happened to the county's tax revenue during the Great Recession, and that we would have needed $600 million in reserves in order to continue funding at the same level. And keep in mind that that number would be even greater in today's dollars. And while we've made some progress in recent years, including establishing and funding a service stability reserve, we still have a long ways to go. And it will be important to continue building reserves in future years to the extent feasible. I mentioned the budget priorities earlier and wanted to share some of the process that supported development of those priorities leading up to this year's budget, which started in mid-2021 with input from the county's advisory boards and commissions that informed a public opinion survey of county residents in the fall of 2021. Based on the results of that survey, which was scientifically representative of county residents, the board adopted budget priorities for this year's budget in December of last year. And I'll show you what those priorities look like on the next slide. And then we're now in the process of potentially refining or reaffirming those priorities for fiscal year 2023-24, which includes focus groups of county residents that took place last month, as well as today's workshop. And with the recommendations for the fiscal year 2023-24 budget priorities planned to go before the board in January. So the board approved budget priorities for fiscal year 2022-23 are shown here and really echo a lot of the themes that we have already talked about. So they are complying with the county's legal, financial, regulatory, and policy obligations. So we talked earlier about the framework that we operate in and the obligations that the county is required to comply with. The second priority is really maintaining existing service levels budgeted for county programs. We did see in that survey of county residents that there are many services that are both a high priority to residents and that they're satisfied with the current level of service. And we certainly want to make sure that we're maintaining that. And then third is funding new or enhanced programs, but really focusing on those that are the most critical and urgent needs. And that really is coming from the survey and other outreach that we've done, which really shows that the highest need and the highest priority identified is a county-wide focus area of addressing homelessness and its impacts, including housing, mental health, and substance use. And then an unincorporated area focus area of improving the condition of streets and roads. And as I mentioned, Ron will touch on that in his presentation. So that brings us to our third polling question. So let's go ahead and get that launched. And again, if you don't know the answer, please give it your best guess. So for the fiscal year that begins on July 1st and ends on June 30th, what is the date by which the recommended budget must be approved? So you can choose from January 1, June 30th, July 16th, October 2nd, or December 31st. Give folks a few more seconds to put their answers in there. Okay, let's go ahead and we'll close the polls, share the results. All right, this is a pretty smart group. Everybody got it right. So the answer is June 30th. Essentially, the recommended budget does need to be approved before that fiscal year starts on July 1st. Okay, so and I'm going to show you a little bit about what that budget timeline actually looks like for us. So the next couple of slides really lay out the budget timeline in detail, and I won't go into all of those details, but I do want to point out some of the key dates. So we really are now in the process of developing that recommended budget for the fiscal year 2023-24, which will start on July 1st of 2023. And the blue boxes here on this timeline are really showing where there are public meetings and opportunities to participate in the budget process. And the top is really showing our internal budget process. So you can see all the steps in there and sort of why it is that we need to get started so early in this process. But looking just at those blue boxes, here we are today, December 15th, with our public budget workshop. As I mentioned, we plan to be before the board in January with recommendations regarding the budget priorities for fiscal year 23-24. So that's planned for January 10th. I will say that the dates on here are all subject to change, but these are what we are planning for right now. We do also plan to be at the board in March with the second quarter fiscal review for the current fiscal year 2022-23, and that's really sort of an update on where we are with our revenues and spending for the current year, and that helps us project what our fund balance is going to be that would be a source of funding in the 23-24 budget. Looking forward, sort of taking us through all the way through the process to develop the recommended budget, and then we're planning for recommended budget hearings at the Board of Supervisors on June 7th through 9th. And then once that happens, we're actually not done with the budget because, as I mentioned, there's 3 budget documents published per year. So after the recommended budget is approved and the fiscal year starts, we were able to gather information about what happened during the prior fiscal year. And that tells us what our actual starting fund balances will be for the 23-24 year. And we also have more information about what the state's budget looks like. So all of those things result in revisions to the recommended budget. And so in September, so this showing here, September 6th through 8th, there are revised recommended budget hearings. And then the budget does get formally adopted by the Board of Supervisors at the end of September, and that will be September 26th this year. So in addition to participating in upcoming public meetings that I just talked about, here are some other ways to get involved or to just learn more about the budget. First, wanted to let you know that this recorded presentation will be available on the county's YouTube page. As I mentioned earlier, you can always submit questions and comments by email to budget@saccounty.gov. You can view budget documents and use the Budget Explorer tool on the Office of Budget and Debt Management webpage. You can apply to serve on a county advisory board. So there's a link to be able to get some information on that. You can write, email, or phone your county supervisor. And finally, you can also sign up to receive information about the county's budget. We will be displaying the slide again at the end of the presentation. And this PowerPoint will also be posted to the budget and debt management website so that you can refer to these links later as well. And with that, I'd really like to thank everyone for their interest. I do want to pause now to see if there are any questions I can address from the Q&A.
Hi, Amanda. There are no pending questions.
Okay, great. Thank you, Kim. So with that, I will now turn it over to Michelle Callejas, the county's Director of Child, Family, and Adult Services.
Thank you, Amanda, and good evening, everyone. Thank you so much for taking the time to join us tonight. As Amanda said, my name is Michelle Callejas, and I have the privilege of leading the Department of Child, Family, and Adult Services, or some folks call it DC FAS. So our department serves some of the most vulnerable community members across the age span. We have three main divisions: Child Protective Services, Senior and Adult Services, and our department administration. We have just under 1,250 employees. And I didn't dedicate a whole slide to our department administration, but I do want to give them a shout out because they are the backbone of our department. They make sure that our budget is appropriated correctly, that we pay our bills, that we get contracts executed timely, and pay our contractors for the services they provide. And then they also manage our facilities and over a fleet of over 250 vehicles. So they're quite busy and they keep us running each and every day. I also want to call out our Gifts from the Heart program. Every year we have community members, other departments that join in to buy gifts for children in foster care and our older adults being served by our department. Last year, over 2,500 gifts were distributed. And this week and last week, we've had volunteers going out in the community delivering gifts. So it's a great program, again, overseen by our Department of Administration. So I'll start first with Child Protective Services. We currently have about 1,350 children in foster care, and that has gone down steadily over the last 15 years or so. But most recently, over the last 7 years, we have been making some targeted investments and have been able to reduce the number of kids in care by 44%. We have a 24/7 child abuse hotline, 875 kids, as well as an investigative, several units of investigative social workers. We get about 4,100 calls to our hotline each month, and we conduct about 780 child abuse investigations. We strongly believe in our department that when it is safe to do so, children and families should remain together. And so we have an array of intensive services where we wrap families that have higher risk and safety factors. And we do everything possible to provide domestic violence services, substance use treatment, parenting classes, wraparound services to try to keep the family together, promote protective factors, and keep them out of foster care. When children do have to get involved with the child welfare system, we have permanency services. The first thing we want to do if we do have to remove is get children back with their families through family reunification. We also have an adoptions unit, guardianship, and then we have a team of social workers who serve young adults, 18 to 21, and they assist with employment, housing, teaching financial management, helping promote social connections, anything to support them to transition more successfully into adulthood. And then we have a robust quality management team. We strongly believe in data analysis and analytics to inform continuous quality improvement. It's also a way for us to be accountable for outcomes to the children, families, adults we serve, as well as to our community. We've got a few key initiatives in the Child Protective Services Division. really excited about prevention, and they all touch on the theme of prevention. The first is the Family First Prevention Services Act, which is federal funding. We're still trying to get approval from the feds, but that will allow us to use federal funding for prevention services. Our major source of funding is Title IV funding of the Social Security Act. And at present, it doesn't allow us to pay for prevention services, services that could keep children and families together. It also doesn't allow us to pay for services to prevent children from re-entering foster care. Fortunately, here in our county, we have made many investments in prevention, so we've been able to be ahead of the game, and this will only benefit us further. Another key focus is a reduction of racial disparities. African American children and families are disproportionately represented at every point in our system, from the number of calls to our hotline, to the number of investigations that are completed, to substantiations, removals, entries into foster care. And African American children are more likely to spend more time in foster care and more likely to be placed in the congregate care setting. So we have been focused on this for many years now. We have seen some reductions in racial disparities. We still have a ways to go to eliminate them completely. And all of this and the investments that we've been making locally has really been shifting us toward a more of a public health approach within child welfare and bringing together other child and family serving systems. You'll hear from Tim Lutz shortly, Director of Health Services. We have a countywide partnership with our human assistance partners, behavioral health, including substance use treatment, our County Office of Education, Alta Regional Services, First Five, community-based providers that are embedded in our community and provide upstream services to strengthen our families. We will continue doing that because we want to address safety risk factors early on, help support families so that they don't have to get involved with systems, either our system or the juvenile justice system. So our first poll question, which division is not part of Child, Family, and Adult Services? Leave it open for just a bit. All right, let's close the poll and see what we have. Great. Child support services. That is the right answer. The majority got it. We do have a great administrative team, but we often get calls for child support services, so we refer them over to our sister department. Thanks for participating. So senior and adult services. So unlike child welfare, where it's kind of a continuum of services across the child welfare system, each program within senior and adult services is unique and has different mandates, different functions. So I'll go into each of them. First, we have our adult protective services, and we have a small senior volunteer team. Our adult protective services, similar to child protective services, has a 24/7 elder abuse hotline, 874-9377. And they receive about 1,900 calls or reports a month. We also have a team of investigators, and they conduct about 400 investigations a month, with neglect being, I think, the top allegation that's investigated, but also financial abuse. We have a senior safe house that has been operational for at least 10 years, has capacity of 6 beds, but we're excited to have a new senior shelter coming on board in early 2023. And we have a small foster grandparent program where we use senior volunteers. They get stipends and they work in our local elementary schools to promote reading and literacy skills. We have our public administrator, public guardian, public conservator's office. I'm going to speak to the public administrator and conservator because we don't really do the public guardian function. It's very rare. So for our public administrator, when an individual in our community dies and does not have a will or does not have anyone available to administer their estate, our team comes in and we do estate management. So they harness and the assets of the individual that is deceased. They sell real or personal property. Then they search for heirs, relatives that they can then distribute the estate to. Last year, they managed over $15 million worth of assets from those who have deceased, those who have died. Our public conservator, we have two types of conservatorships: probate conservatorship and then LPS, or Lanterman Petrus Short conservatorships. And the probate conservatorships are those adults who cannot take care of themselves. Same with Lanterman Petrus Short, except for those ones involve individuals with mental illness. The probate conservator, our teams help with financial management, housing, medical care, placement, and they do a lot of advocacy. For the LPS conservatorship, our team is responsible for directing the mental health services as well as the placement of those that are conserved. We have our in-home supportive services and our in-home supportive services public authority. In-home supportive services pays for services for older adults, adults with disabilities, and even children with disabilities, so that they can that are receiving services. And then our IHSS public authority are responsible for recruiting in-home care providers, providing them with an orientation, and then maintaining the provider registry, so that when we get new recipients applying, which we continue to see growth in, they have an array of folks that they can interview and see if they are a match for coming into their home to provide services. We currently have about 31,000 care providers and seeking more. We have several key initiatives. The first is the Governor's Master Plan on Aging. And that really is the governor's effort to expand capacity of disability and aging services. It looks like I may be frozen. Can folks hear me? Okay, I apparently our internet at work is a little bit unstable, but I think I'm back. So the Governor's Master Plan on Aging seeks to expand aging and disability services across our state. And locally, we opted into the Age-Friendly Network of Communities, which was supported by our board. And that looks at both areas, look at like housing, accessible and affordable health care. For the age-friendly, we're looking at transportation, walkable streets, programs that reduce social isolation. We also have we got a lot of additional dollars from the state, which is unprecedented, to be able to expand adult protective services. We used to only go out on older adults 65 and older. Now it's 60. We have Home Safe funding, which allows us to assist with housing and also provide short-term housing assistance for those that are experiencing housing instability. We have an Access to Technology grant that we were recently awarded to promote digital literacy for our older adults, and also to do it in a way that's safe so that they aren't victims of scams. And then we have our community care expansion, which is going to allow us to expand residential care settings, which really increases and adds to our housing continuum to improve outcomes, prevent homelessness or unnecessary institutionalization. So a lot of opportunities in the aging and adult services world, which we're really excited about. So our next poll question is, which program pays for in-home care provider services to allow individuals to remain in their homes rather than in an institutional setting. Okay, let's wrap it up. Excellent. 100% got it right. Thank you. So this slide shows where all our funding is distributed across a division. So as you can see, Child Protective Services clearly has the majority of our funding at 72%. All the programs outside of administration are all for our adult services, and that adds up to about 22%. And then our administrative services comes in at just under 6%. My hope is with increased opportunities for our older adults and individuals with disabilities that 22% pot will grow over the next few years. And then this slide looks at the type of funding in our budget. So our total appropriations are $286.7 million. And you can see our largest allocation is realignment at 36.5%. So this is the semi-discretionary funding that Amanda alluded to earlier. It is 1991 and 2011 realignment. Our second largest source is federal, and we have a lot of different federal funding in last year's budget, including the biggest source is the Title IV-E for child welfare services. We also have Title 19 for health-related services, Title 20, which is our social services block grant. So a lot of different federal funding that we receive in our department. And next is the intra-fund reimbursements, or just transfers in and out to other departments, mainly for specialized services. And then the next highest allocation is our state funding. So this is the departmental funding that Amanda mentioned earlier. And then lastly, coming in is our discretionary pot, or general fund, or net county cost. We have about 7.3%. And this, the majority of it goes to services in our community that support prevention and that also support services that realignment is not eligible for. So total appropriations, $286.7 million, just under 1,250 FTE. And now I'll open it up for any questions.
All right, I think Michelle might be having some video challenges, and it looks like there weren't any questions. Just confirming that with PIO before we move on, or if Michelle's back.
Tim, I think you can probably proceed with your presentation and we can circle back for questions if we have them.
Because that question I can't answer for Sacramento County. All right, wonderful. Well, thank you. Good evening, everyone. Thank you for tuning in today. My name is Tim Lutz, and I am the Director for Department of Health Services. Often we refer to it as DHS. The goal of DHS is to provide access to high quality healthcare services for Sacramento County residents, including medical, dental, mental health, and substance use prevention and treatment services. In order to deliver on this, we're organizing the 3 service divisions, and then those service divisions are supported by an administrative team. Our service divisions, first is behavioral health, which is responsible for mental health and substance use prevention and treatment for Medi-Cal beneficiaries. Our public health division promotes, protects, and assures conditions for optimal health and well-being within the community. And then our primary health division oversees physical and mental and social well-being of some of Sacramento's most vulnerable. Our administrative team, and again, like Michelle, our administrative team really helps keep all of our lights on, helps keep things moving. They do a lot to support department operations. Our department with DHS, we have over 700 contracts and operate at 12 facilities. So our administrative team helping with fiscal, budget, and other administrative support is a crucial link for all of us. Starting off then with our first poll question, which is not one of our service divisions at DHS? Public health, behavioral health, primary health, or mental health? And I'll pause and give everyone a moment to answer that. All right, thank you. Yes, the majority got the correct answer. Mental health is not one of our service divisions. Mental health is part of behavioral health, but behavioral health also includes our substance use prevention and treatment, or SUPD. All right, this next chart now illustrates the departmental various funding sources or revenues. Can see our adopted budget for fiscal year 22-23 was $726.5 million. And that supported and funded 1,176.1 FTEs. An important note with this and a lot of my subsequent slides, the adult correctional health and juvenile medical services budgets are not included in this chart because they're budgeted in a separate unit under the department. I will cover those later on in my presentation. When we look at our revenue and how we operate within the department, one of our important goals that we have is to leverage our county realigned and local dollars like general fund to draw down and maximize the use of state and federal dollars. So looking at this pie chart, you can see about 43% of our funding comes from federal and state dollars. Then others such as MHSA, a voter-approved act that provides services for behavioral health, that comes from the state to counties based on the millionaire's tax. And then our realigned programs, 2001 and 1991 realignment, both formerly state programs that have been realigned to the county with a dedicated revenue stream. Looking at a different snapshot of the department, this shows you our total appropriations or expenditures by division. You can see certainly the vast majority of our appropriation goes to our behavioral health program, with 74% or about 3/4 of our budget. The next slice of that pie, the next largest, would be our public health. And I'll call out public health here at 15% of that pie. If we had looked at this in 2018-19 pre-pandemic, you would have seen an even smaller slice of that pie with public health. As a result of the pandemic and historic investment within the public health programs, we've started to see that percentage get larger. If you look at as a percentage of growth within within the department, public health had the highest percentage of growth of any of the departments, with 130% increase since fiscal year 2018-19. Then 7% of our budget goes to our primary health programs, and then 4% to our administrative functions. All right, so this brings us to our next poll question. Which division has seen the most growth since fiscal year 2018-19 in DHS? Behavioral health, public health, or primary health? Waiting for everyone to answer and look at the results. All right. Divided between behavioral health, getting a little higher, and public health, the correct answer being public health. Again, behavioral health does have that, definitely the largest slice of pie, and dollar amount has grown. But when you look at percentage, our public health has grown at a higher percentage than behavioral health. All right, this part I want to talk about a little bit into each of our divisions, some of the key initiatives. Certainly we all recognize and have seen a lot of discussion around behavioral health services and the continued high demand and need within Sacramento County and across the state. Within DHS, we're looking to add more access points across the behavioral health continuum. We continue to identify investment and infrastructure opportunities across the county for behavioral health services. In fiscal year 22-23, the county invested an additional $26.7 million in behavioral health infrastructure. Some strategies that we've been doing to try and meet that increased need include our community wellness response team and wellness crisis call center. That's deploying mobile and telephone-based crisis services to the community. We've also funded and launched 10 community outreach, recovery, empowerment, or CORE behavioral health centers to address outpatient needs throughout the county. Then also our homeless encampment and response team, or HART, is a multidisciplinary team which partners across county departments and community-based organizations that includes behavioral health clinicians that can conduct and provide outreach and engagement to homeless shelters and encampments and do linkages to services. We've also been working on expanding resources for involuntary service populations. Examples of those would be assistant outpatient treatment, or Laura's Law, and the implementation of forensic full-service partnerships within our continuum of services to that criminal justice population. Recognizing treatment beds is an area that a lot of counties are trying to build capacity in. That Sacramento commissioned a study by the RAND Corporation to try and identify how many treatment bed gaps we had across our system. In working with that data-informed report, we have focused our attention on supporting development of beds to treat individuals in need of substance use treatment services, and also expanding the subacute beds within the community. Those both identified as the highest need within Sacramento based on the RAND study. Moving now to our public health initiatives. As I mentioned in the appropriations slide, building out the public health infrastructure has been a large focus of the department and also the state. The 2022 Budget Act in California included $300 million in state general fund for ongoing public health funding. That's known as the Future of Public Health Funding. Sacramento County is receiving $7 million of that on an annual basis. And what we're looking at and what the Future of Public Health aims to do is modernize our public health services to better handle future threats. So that can include workforce development, recruitment and training, emergency preparedness, community partnership development, a lot of opportunities to improve our system within public health. Some initiatives we're specifically narrowing in on is public health accreditation, of course, developing workforce, bringing on some additional staff positions, providing ongoing training and education. We're also very focused on efforts to address health and racial disparities across our service delivery system, recognizing racism as a public health crisis and the crucial role that we can play in helping address negative health outcomes that disproportionately impact communities of color. Then finally, we're also bolstering our resources to support homeless response teams and other county partners with community nursing units that are targeting at-risk families with young children. So this brings us to our final poll question for my slides. How much funding is our public health division getting from the state via the Future of Public Health funding? $7 million, $3 million, $108 million, or $15 million? Pause for a second and allow people to respond. Thank you. So answer is actually 7 million. So the Future Public Health, $300 million across the state, $7 million for Sacramento County locally. All right, so now I'm talking about our primary health division. Sacramento County, we operate a federally qualified health center, or FQHC. It's the Sacramento County Health Center. I should say primary health center, apologies. The clinic provides comprehensive care to the Medi-Cal enrollees. We also provide services through the Healthy Partners program, which is a funding source for Sacramento County's undocumented residents who are not eligible for Medi-Cal. The clinic also encompasses the Refugee Health Assessment Program. Last year, this program served over 4,600 patients from 18 different countries. The highest number of individuals served in countries, or the countries they're from, were Afghanistan and Ukraine. I also want to highlight that the work that we do at the FQHC is really a result of a strong partnership with UC Davis School of Medicine that provides medical residents and doctors to those clinics. Next, our primary health also encompasses a full-service pharmacy program offering clinical review, dispensing, monitoring, and compliance to county programs. And then finally, the Sacramento County Health Authority Commission, or HAC, also within primary health provides some oversight and accountability to health plans that serve the Medi-Cal beneficiaries in Sacramento. The goal of HAC is to improve overall health care quality and access for Medi-Cal beneficiaries. Changing now, the last piece within primary health is our adult correctional health and juvenile medical services. And again, I mentioned these are budgeted separate, which is why I'm presenting them here separately, so you can see that total expenditures, or the funding going into the program, and FTEs. I'll highlight first that in contrast to funding with other DHS programs, our adult correctional health and juvenile medical services are primarily funded through general fund contributions. Certainly that's the largest revenue source in both of those programs. The adult correctional health program is $88.4 million in funding and has 219.5 FTEs. This program administers the health and mental health services to adult inmates in the county jail system. And that includes medical, mental health, dental, and specialty ancillary services. During fiscal year 22-23, our staff performed 2,474 intakes per month within that program. Next, our juvenile medical services is $10.67 million in funding and 25 FTEs. Like the adults, providing health, mental health, dental services, specialty care, this to our juvenile correctional detention facility population. Our staff there provide roughly 100 health screenings, 75 comprehensive medical evaluations, and 50 physicals per month. And last slide for the department is a broad-based view of some of the key transformative initiatives that are happening at DHS and also taking place at the state level. The first, California Advancing and Innovating Medi-Cal, or CalAIM, is California's Medi-Cal reform and managed care plan service delivery revamp. New services that are being rolled out in phases based on population of focus are spread out amongst services and community populations that many of our county partners, in addition to DHS, are actively serving and trying to increase service delivery to. Examples being those that are homeless, those with severe mental illness, incarcerated, and youth in foster care. Where DHS is working with other county departments and community organizations to try and help align those initiatives with CalAIM goals, with the goal of helping to ensure an ongoing funding source to augment existing programs. Then our Social Health Information Exchange, or SHE, is a data exchange amongst partner organizations to share allowable and client-approved information to assist in improved care coordination and linking people to a wider range of services. It'll provide tools for managed care plans, provider organizations, and case managers to help manage care, make referrals, and connect people to resources, resulting in better outcomes. The initiative is strongly aligned with the goals of the state's data exchange framework, the aforementioned CalAIM, and the county's efforts to expand services to individuals experiencing homelessness and our incarcerated population. And that concludes a summary and overview of DHS. I'll pause here and see if there are questions.
Thank you, Tim. There are no outstanding questions for you.
Nice. Kudos to Kim Nava, County PIO, and the team for answering those questions fast and quickly. Thank you. I will hand it off then to Ron Bakary to talk about Department of Transportation.
All right. Thank you so much, Tim. And thank you to everyone for joining us tonight in this workshop. My name is Ron Bakary. I'm the Director of Transportation for Sacramento County. And I am very thankful to be chosen as one of the departments to participate in this workshop and to talk to you about the funding and budget overview for the department, as well as our biggest challenge, which is the roadway network needs. But first, to give you kind of an overview of the Department of Transportation, we are responsible for planning, improving, operating, and maintaining a transportation system that serves the unincorporated county citizens and regional traffic and commerce. We have approximately 250 incredible staff, and we are located at the county's Bradshaw complex, which is at the corner of Bradshaw and Kiefer Boulevard. We have 150 pieces of heavy equipment, 112 vehicles. We have an operating budget of $68 million and a total budget of over $200 million. Oops. The Department of Transportation's budget is made up from many sources: developer fees, general fund, gas tax, SB1, and Measure A. The gas tax makes up $37 million of our budget. It provides transportation maintenance and operations, transportation planning and programs, contracted right-of-way landscape maintenance, and it also provides us with a local match for our federal, state, and state-funded competitive projects. Measure A makes up $26 million of our budget, and it provides the signing and striping and traffic signals and operations, traffic engineering, right-of-way management, traffic counts, our bridge maintenance, our landscape division, our potholes, and really everything that makes up our roadway maintenance department for $21 million of the $26 million. The remaining $5 million goes towards bike and pedestrian safety construction projects. Our developer fee this year made up $24 million. That fluctuates greatly from year to year and is generally in the area of $10 to $12 million. That funding stream is required to go towards capital projects that support housing development and other types of development within the unincorporated county. And in years past, we've received a $2 million general fund contribution for pavement maintenance, homeless initiatives, and graffiti abatement. I'll talk in future slides about how that's increased over the years to help us deal with the greatest challenge we have, which is our pavement maintenance. We also receive regional and state funding of $34 million. Some of the projects this year that money will be focusing on, the top 10 projects, are overlays that we receive through SACOG, or Sacramento Area Council of Governments, the Florin Road Bike and Pedestrian Improvement Project, the Fair Oaks Boulevard Bike and Ped Mobility Project, Power Inn Road Bike and Ped Project, Hazel Avenue Phase 3, we just held the ribbon cutting, which goes from San Juan to Madison Avenue, and Watt Avenue Complete Streets Project. We also have street lighting going on Coyle Avenue, Hillsdale, and Watt Avenue, and Folsom Boulevard Complete Street Improvement Project Phase 1, Power Inn Improvement Project, and the Arden Way Complete Streets Project. Our Measure A makes up $14.1 million of our budget. The projects in Measure A, the Measure A CIP, the projects that we put the money towards have to be in the CIP for Measure A, the capital improvement plan for Measure A. Projects we're working on this year are Hazel Avenue at US 50 Interchange, Hazel Avenue Phase 3 that I just mentioned, Watt Avenue Complete Streets, South Watt Avenue Improvement Project, which goes from Florin Road to State Route 16, and Greenback Lane improvements. And that brings me to what I've mentioned is the biggest challenge within our department, which is our roadway network needs. We currently receive $30 million that goes towards our roadway network and allowing us to maintain the roadway and the road miles that we have today. This is made up of SB1 funding and regional funding that we receive through SACOG. And this truly is the stable funding that we can count on from year to year. And that $30 million sounds like a lot of money, but as you'll see in the remainder of these slides, how enormous our roadway network is and really the cost it takes to maintain that network. Our roadways, we have 5,000 lane miles of roadways, or 2,215 centerline miles. Our roadways are made up primarily of residential roads, 61%. We have 15% of our roads are the collectors, which are the roads that take traffic from residential roads to our major roads, which are called arterials. Our arterials make up 24% of our pavement network. and our total asset value is $6.2 billion. Pavement conditions are rated from 0 to 100 on a scale called the Pavement Condition Index. From 70 to 100 are excellent to good pavements. From 50 to 69 are pavements that are in fair condition. From 25 to 49 are pavements in poor condition, which is highlighted in red because our average pavement condition is 48. Therefore, we fall into the average condition of our roadway network being in poor condition, and 0 to 25 being pavements that are in very poor condition. To give you an example, this is a picture of a 46 pavement condition index. This is similar to the average condition of our roadways, as I mentioned, being 48. Some other examples are this is a pavement condition index of 34. And as a pavement gets below 25 pavement condition index, you can see that it's deteriorated to a point of requiring reconstruction in most cases. And the reason why that's significant is this is what's referred to as a pavement deterioration curve. And you can see on the left-hand side, a pavement condition index of 48 is really in the steepest part of the curve. As the pavements deteriorate over the course of their lifetime, they deteriorate at a much faster rate as they near the end of its service life. And most importantly, if pavements slip to where we are in most pavements requiring an overlay, to that requiring full depth reclamation or reconstruction, it costs the county 4 times the cost to reconstruct a roadway than it does to overlay a roadway. So we really are at the critical stage of our pavement's life. This chart gives a comparison to other, to other counties. San Bernardino County, you can see, has pavements of 80 PCI, average PCI of 85. And you can see that Lake County and Mendocino County are beneath us, where we show 48. This slide shows a comparison to neighboring jurisdictions. You can see that Sacramento County does have the lowest PCI in our area. And that's because the Sacramento County developed in the 20s, 30s, 40s, and 50s. And just by the age of our pavement, the needs are really, really high. The city of Sacramento at a PCI of 59 would have a similar PCI to us if you remove some of the newer neighborhoods. For instance, if you removed the Natomas neighborhoods, you would find that the city of Sacramento, having developed in the same era that the Sacramento County did, you would find a similar PCI to ours, and they have an equally challenging pavement network. So as I mentioned, we receive and have a stable funding stream of $30 million a year from SB1 and regional funding. We know that with only contributing $30 million a year to our pavement network, our pavement condition index will deteriorate to a 31 over 20 years, increasing our backlog to $1.9 billion. We also know that it requires $50 million a year to maintain the status quo PCI of 48. It will increase our backlog to $1.3 billion because of the cost increases to address that same pavement condition. But it is $50 million a year to keep our pavements from deteriorating any further. Our goal, and this slide shows that it takes $70 million a year for the next 20 years to get to our goal of a 70 PCI over 20 years. With the $30 million shown in red, we have a significant challenge on our hands. 2 years ago, the board contributed $20 million of general fund revenue to close the gap from 30 to 50 to keep our pavements from deteriorating any farther. This year, we received $40 million of general fund so that this summer we will be putting out $70 million of overlays. This is the largest amount of money that we've ever put into the roadways, and it will make a significant difference. Although you recognize that with an $850 million backlog, $70 million will not address anywhere near the amount of roadways we'd like to. But our hope is that everyone will have either their road addressed or roads that they commonly travel, and you will see a significant difference. This is the first year that Sacramento County roads will be better at the end of the year than they were when the year began. And we are very excited to have reached our goal this year. So with the $40 million contribution from the general fund, we are able to stabilize our PCI. We can improve the pavement condition, and we can reverse the downward PCI trend, avoiding expensive reconstruction. And most importantly, this gives us time to pursue additional funding to close that gap. So in conclusion, the roadways network for the Sacramento County unincorporated county roads is $6.2 billion. The average road condition is in poor condition with a PCI of 48. SB1 has made a significant difference. But $30 million, with the $30 million contribution only, our PCI will decrease to 31 in 20 years. Our deferred maintenance will increase to $1.9 billion, and more than half of our roads will be in very poor condition. With the added funding approved by the board, we are able to stabilize our overall PCI, reduce our deferred maintenance backlog, and avoid expensive reconstruction while continuing to pursue additional funding. The roadway pavement network needs are our biggest liability at over $800 billion in backlog. Closing the gap with continued stable funding is our highest priority, and closing the gap really is the only way to prevent further deterioration of our roadway network. With that, I'd like to ask Kim if there is any questions that we can have at this time.
Thank you, Ron. There are no outstanding questions for you.
Great. So with that, I appreciate again everyone taking part in this workshop, and I'd like to turn it back to Amanda.
Great. Thank you, Ron. As I mentioned earlier, I did just want to end with this slide that I showed earlier in my presentation with information on the different ways that you can find out more about the county's budget or get involved in the budget process. We will also be sharing this presentation on the Budget and Debt Management website, bdm.saccounty.gov, so that you can refer to these links later. And I would really just like to make sure that I thank all of the panelists for the wonderful presentations today, and especially thank all of you who have joined us to participate today. We really appreciate your interest and hope that you found this workshop helpful. And that will conclude the workshop. Thank you.